I'm Armond Budish. We bring you the real news behind the headlines, right from the folks making the news. My guest today is Dr. Christine Alexander, CEO of MetroHealth Hospital, a key player in Northeast Ohio. Good morning, Doctor.
Good morning. It's great to see you.
Oh, it's so nice for you to be here. Thank you. And thanks for taking a few minutes out from seeing patients, which you're still doing, I gather.
Sure do.
So, as CEO of Metro, tell us about Metro.
So I think most folks recognize that we have some pretty major health systems in town, and we're proud to be one of them. Our focus at MetroHealth will always be taking care of our community. We have over 300,000 patients. Last year we saw just shy of 1.5 million visits, and that's everything from primary care to specialty care to subspecialty care. And I think most folks know that focus on clinical, but what they may not know is that we're also a major teaching hospital. We have a multitude of residency training programs with hundreds of residents. We take hundreds of medical students every single year for their training opportunities, and we do top-notch research for which we get recognized throughout the country. So it really is a very robust healthcare system.
Metro is such a gem for Northeast Ohio because it always gave me confidence to know that if Medicaid went away, if Medicare went away, we still have Metro, which is the healthcare provider to anyone.
That's
regardless
correct.
of ability to pay, we have Metro.
That's right.
So my question to you first is, how do you attract, I've had the experience with your doctors and nurses and staff, how high quality they are.
Yes.
How are you able to attract those folks to Metro?
Well, I appreciate the question. I think when we think about Metro, we really think about our mission. And like I said, we're always focused on the patient and the community. And because of that mission, we attract like-minded, mission-oriented talent. And that our focus on mission really, really helps us, because someone who's coming into us that isn't mission-driven, well, they're not really going to provide the same quality of care because they're not going to be rooted in the same value system that roots all of us who work there. And I appreciate you talking about the quality of our caregivers, because we really have incredible staff throughout the whole of the organization that come in because they want to be part of the mission. We have t-shirts that we proudly wear that says you come for the mission, but you stay for the culture. Because I think when you're mission driven, there's a unity that happens amongst all of your staff that you perhaps don't get in other institutions that don't have that kind of unifying value. And so that pulls us together and actually really helps us to attract top-level talent.
That's great. It works out real well for all of us in the community.
It does.
I have had the pleasure over the years of getting to meet a lot of your folks, and I've been impressed uniformly across the board by everybody who I've. So
appreciate that.
No, I don't say that. I get nothing for saying that. I'm just a fact. Now, Metro is known as being a level 1 trauma center.
Yes.
And for many years, it was the only level 1 trauma center in Cleveland.
Correct.
And now it's not the only level 1 trauma center. And there was just a news report about another hospital, the Cleveland Clinic, starting a level 1 trauma center, or wanting to start a level 1. Tell us about whether that's a good thing or a bad thing.
Sure. So we, of course, are the premier level 1 trauma center for the community. We've had a program for decades. We post very high quality outcomes and scores because we really focus on the trauma, and what makes a good trauma center is really when you are a high volume trauma center, because it's not just reliant upon any one piece of trauma care. Trauma is very complicated. Trauma comes in through EMS programs.
Yeah.
So let me explain a little bit. That's a great question, because trauma care is a little bit different than emergency department care. So emergency department care is if you have an acute illness or an injury that perhaps, you're home and you're slicing bread and you cut yourself. That's an injury that the emergency department would care for. Or if you're concerned that you're having a heart attack or a stroke, right? Those sorts of things would go to an emergency room. And an analogy we like to make is a little bit like a mechanic shop, right? If something breaks down on your car, you're going into the mechanic shop to try to get it addressed, right? Trauma is different. Trauma are much more significant injuries, a significant fall, a motor vehicle accident, a shooting, a stabbing. Trauma tends to impact multiple body systems or body organs and is more life-threatening in general than some of the other things that will come in through the emergency department. Not to make light of strokes or heart attacks, because certainly, right, the emergency department does provide life-saving care, but trauma is a much more significant injury, and it takes quite a few different specialties coming together in sync, constantly in sync, understanding how they each communicate and what they each contribute. It starts with EMS on the scene stabilizing patients and bringing them in, the communication between EMS and our care teams, both in the emergency department, because our emergency department physicians and staff participate in these traumas, our trauma surgeons coming in, other specialists, other nurses. It's an entire program. It's almost like an entire city in and of itself, right, with all of these critical pieces. The other analogy really is like a pit crew, a Formula One pit crew, where everybody knows their role, everybody understands it, and they work together so frequently that they anticipate each other's moves, and the communication is just streamlined because they do it all of the time. The danger of introducing too many trauma programs to a city is that the experience gets diluted. There's only so much trauma cases to go around, and when you start to dilute that experience, then the communication breaks down, then the skills start to deteriorate, and then that puts patient lives at risk.
Don't we have a lot of trauma in the Cleveland area with shootings and stabbings and burns?
Correct. So there are actually analysis that look at the size of population and what happens in that community, and that dictates how many trauma centers you should have. So if you look at our community, and it depends on how you define community in Northeast Ohio, right? Do you dip down to Youngstown? Do you include Akron? Do you include Canton? Right? If you
do they have trauma one centers down there?
Well, there's a level 1 trauma center that the Cleveland Clinic already has at Akron General, and there's a level 1 trauma center that Mercy Bon Secours has in Youngstown. So there are some trauma centers that are level 1 scattered throughout the community. But if you look at the community, the numbers that the high quality research shows is that we need 2, level 1 or level 2 trauma centers. So we most certainly don't need a 3rd level 1 trauma center, because again, that puts the community significantly at risk for bad outcomes because the experience is diluted. It also raises healthcare costs, because if you add in a center where it's not needed, you now need to duplicate all of the staff. So all of the staff we already have at MetroHealth, all of the staff that University Hospitals already has, gets duplicated. And when that happens, wages start to go up, costs of programs start to go up, you have to enhance your emergency department, so paying for the costs of construction, right? Those costs increase.
But would competition lower prices?
So competition won't lower prices because it's trauma, right? And so in trauma, you are taken to the closest emergency department that can provide the care that you need. So competition between trauma services actually is much, much worse. And that's what's been demonstrated time and again in the national research. So you really don't want competition in trauma centers. And to whatever degree, you want to foster collaboration so that the patients get to the right place at the right time and receive the right care. So competition actually is quite bad for trauma centers.
Metro is near West Side.
Correct.
And clinic and UH are the East Side.
Correct.
So wouldn't the competition, the impact be worse for UH with clinic opening another trauma center than it will be for Metro?
Well, I think time will tell, right? I mean, initially, two trauma centers being located very close together, I think that there will be a diluting of experience that happens on the East Side first, but I think eventually it will spread because we also accept transfers from outside the region in. So it really depends on how that plays out in the market. But again, back to the idea that outcomes will get worse, right? Costs will go up and outcomes will get worse.
You can cover the whole area. You have the magnificent Life Flight.
Correct.
That picks people up when they need help anywhere.
That's right. That's right. So you know, our Life Flight really can get to places very efficiently and very effectively, and they can start some of the care before, you know, the patient even gets into the hospital itself.
Is the clinic's Trauma One Level Center, Trauma Center, a done deal, or is there anything left to wait on?
So there's an actual process to becoming a Level 1 trauma center. It really starts at the state level. Some states regulate to say you must, you know, demonstrate a need in the population. Ohio is not one of the states that does that, but generally speaking, you take a look at the population and say, does this population need another center? You know, are there needs that are unmet within the entirety of the community? That's usually the starting point. Then from there, the American College of Surgeons gets involved. And what they do is they create they have an evaluation system that they call their verification system. And they really look to see, do you have all of the important elements that it takes to be a Level 1 trauma center? They give an initial approval so that a center can start taking patients, and then those outcomes are tracked over about a 2-year period before they give the final stamp of approval, thus naming a center a Level 1 trauma center. So there are multiple pieces, and this will still take a few years. However, this summer, the Cleveland Clinic will start taking trauma patients. So the impact is immediate, but the verification will take 2 years to become fully verified.
Okay, switching gears. Metro, I guess, needs a level of Medicaid from their patients.
Correct.
Many other patients. And with the federal government and the state government now imposing additional requirements on the Medicaid program and cutting Medicaid basically, what's that going to do to Metro?
So I appreciate the question. We've actually been seeing a trend of increase in uncompensated care. If we look back over about the last 2 years, 1.5 to 2 years. And there have been a couple things at play there that have resulted in the uncompensated care. A piece of it is, you know, Medicaid and not being eligible for Medicaid. There was increased coverage actually in Medicaid a few years ago because of the pandemic, right? And then as that coverage ended, people kind of fell off of enrollment and were left with the idea of then signing up for insurance through the ACA. So that was kind of the start of it. But since that point in time, we've really seen quite a bit of increase in uncompensated care. So we've worked with the county, we've worked with the state, we work with our federal elected officials to take advantage of other programs and other resources that can help support the work that we do, and that most certainly is helpful. We also knew we had to do our own deep dive into how do we improve our own operations? You know, how do we get more efficient? How do we get more effective? Let's put the community and the patient at the center of that, and what can we do as a hospital system to make things better? And so we did a lot of hard work this year. There was a tremendous amount of sacrifice. You know, when you're already in an environment that's not resource rich, it's not like there's tons of fat to trim, but we really worked hard on trimming what fat we could, but really focusing more on efficiencies. And that made a huge difference for us in 2025. We really were able to meet with quite a bit of success in tightening up our operations and improving our access for our patients. And that's what patients really need. They need that access, right? And they need to come in, especially to come in and receive primary care on a regular basis to try to prevent disease as well as diagnose it and treat it effectively the minute it's been diagnosed. So we're really leaning in to our operations to help lead that way, along with continuing to work with our elected officials around what things we might be eligible for, how can we create, that financial balance that will continue our mission to serve the community.
Metro needed really badly a new main campus. I mean, I've never seen a hospital with a 100-year-old water system that was made of wood. I mean, it was really, really surprising. And Metro has expanded throughout the county now.
That's right.
It's not just downtown.
Correct, right? We're not just the near west side.
So with all that change that's occurred and the cuts to Medicaid at the same time, how is Metro doing financially?
So we're just about to close out our books from 2025, and so we can't really, say a lot of detail around that, except that I'm really proud for the work that we did and how we improved operations. We are spread throughout the community, and we're really proud of that as well. We went through a phase of tremendous growth. We have the new hospital, the Glick Center, that is a fantastic place to practice. I just finished up a week on inpatient, so I'm very grateful for that building. We're also about to open up a new health center on main campus that's 300,000 square feet. The pandemic moved a lot of care from inpatient to outpatient. There was already that trend, but it really accelerated during the pandemic. So we needed buildings that were really well equipped to do the sort of care that we would have probably never dreamed of when I was in medical school. So we're very excited about that. That's opening up in the early summer. So that will afford many more opportunities to get care that will be at lower cost because it's outpatient as opposed to inpatient. We also have our network of satellite centers. We did close some of our satellite centers because we had some centers that were within a few miles of other centers. So we really did the hard work of saying, how do we best serve this community? What's the best location? How do we merge offices so that we now have the resource of staff that can help us expand hours and expand access for our patients? So we did some really challenging work around that and closed 6 offices, merged them into other neighboring offices that had the space. Now we can take full advantage of the staff that we have and expand opportunities for care. So those decisions were tough, but they were important and necessary, and now patients are able to be seen at times that really work for them given their work-life balance.
I'll switch gears on you again.
Sure.
Federal government has done a lot of work to scare the public about vaccines. I mean, now people aren't getting vaccinated for things like measles, which is, I think, going to cause a whole lot of issues. Tell us what the impact on public health will be.
So I'm a huge believer in vaccines. As a primary care physician, I'm all about preventing disease. And so I'm not sure that we could create anything that prevents disease any better than a vaccine. So I'm a big believer in vaccines, but I do know throughout probably the last several years, and I think, even predating the pandemic, we were starting to get a lot more questions about vaccines. And I think what's really important about vaccines is that you have the conversation with the patient. That's a critical piece because I think for years people just came in and we said, you're due for this vaccine, boom, you got your vaccine, often before the doctor even walked in the door, right? And so what I think is really important is that people are much more involved in their care. They want to understand the who, what, where, and why behind everything, all of the testing, all of the outcomes, all of the treatments, they can look up on the internet and find information of varying quality, right?
Yeah.
So today's consumer of healthcare really needs to be engaged in discussion around that. And that to me is the important piece. I think we're starting to see now that kids have not been vaccinated for measles. Measles are coming back, and children are dying of measles again. I don't think that's what we want for our population. And I think for those that declined vaccines, that's not what they wanted either. But they were trying to think through a complex issue with things that they were finding through, searches on the internet, when what needs to happen is come in and talk to the doctor or the APP, the advanced practice professional that gives you your care, and let's have the conversation and understand your concerns so that together we can make the best decisions.
But you talk about getting information, and one of the big problems is that even the federal government right now is putting out information that is of questionable validity, in my view, and as a non-doctor, and that's really scaring people. They are not getting the vaccines in many cases. They are having the conversation, but they go on the internet and they get all this conspiracy talk and other stuff which is wildly, and we're going to see more of that now because I think because Dr. Amy Acton, who was Governor DeWine's healthcare director, is running for governor, and I think is going to bring up the whole conversation, the whole negative conversation again, not for her, but against her in the next election. Mm-hmm. So we're going to see all kinds of information coming out that's of questionable validity about vaccines.
Mm-hmm. Well, I think one of the challenges that we face in science is that information is constantly changing. Right? That's what I value about medicine. We study everything, right? And sometimes it takes us longer to approve medicines that maybe other countries, move through more quickly and approve. We study everything in medicine, and we're willing to admit if there's, we thought one way and now we think another way. We're willing to say, hey, we have new evidence. You see this all the time. Oh, here's what we thought worked, now we know this is what worked, right? So I think in science, that's what happens. That's what good science does. It questions constantly and is willing to say, here's a new idea, here's a new thought. Because of that, there's always going to be research studies out there that point in a variety of different directions. So I do believe that what's being posted, by folks who are in federal government, they really believe in what they're posting, just like I believe in all of the science that I use to take care of patients now. I think it just gets back to that idea of instead of delving into really complicated topics, if you're not a physician, if you're not a scientist, instead of trying to delve in and understand it yourself, come in. Let's have that conversation. Let's understand. Come in and let us understand who you are, what your priorities are, what your current understanding is, and let's have that conversation so you can make the best decision for your children, for yourself, for your family.
Okay, I'm going to shift gears with you one more time.
Sure.
And this may be a little bit of a sensitive topic, but okay. Metro has had 3 CEOs over the last 4 years, which has to be a little. I'm glad you're now the CEO. I'm very
well,
happy
thank you.
about that.
I'm glad too.
But is that disruptive, and how does the hospitals deal with that?
So a year ago, I got the question, you're the 3rd CEO in 3 years. So now I'm the 3rd CEO in 4 years. So we're gaining on it. So anytime you change leadership at the top, most certainly it's disruptive. And it doesn't really matter what industry you're in. Healthcare is no different in that way. I think what's been really important for me this past year was my focus on stabilizing the organization. And it helped me so much that I came to Metro in 1997. And I came here on purpose.
As a doctor?
As a doctor, yep. Right out of training, I came to Metro. And I picked Metro over many other opportunities across the country. So I came to Cleveland to be at MetroHealth. And I've never regretted it.
That's what I think is so impressive, that you have been able to attract people committed to a vision and a purpose at Metro, which as I said before, I've been so impressed by the people who work there.
Yeah, it's so true. And, I was so blessed to be able to come to MetroHealth when I was still in training and spend some time here, and just was blown away by the quality of the people that are here, the relentless focus on the patients and the community, and doing everything we can to really be the guardians of the community, to keep our community healthy and safe. And so I've built up relationships through time, coming as a junior faculty member, doing a lot of work and as a family physician, seeing families, delivering babies, taking care of patients in the hospital, taking care of patients at the jail, taking care of patients in the schools. There are a lot of relationships that I was able to develop through time, and that matters. When someone comes in new to an organization, it takes years to get to know the organization and build up that trust that I already had because I'm one of the people, right? I'm one of the staff. And then in naming people into the executive team, I leaned into folks that have spent their career at Metro, that came to Metro with the same mission focus, that really we are of one mind and one spirit in terms of our mission and ideas that we have, that we can innovate, that we can create this next chapter for MetroHealth. That is creating the stability of leadership that I think we need. The next focus is, of course, we're creating some financial stability now. How do we maintain that? How do we innovate? How do we grow? How do we take care of our community, both outside of our walls, but also inside the walls, the community that are all of the faculty and staff of MetroHealth?
Thank you very much for being here today, Dr. Alexander, and thanks very much for the job you're doing at Metro. Really appreciate it. It really helps the community quite a bit.
Thank you.
So I want to thank Dr. Alexander again for her work at the hospital, and also for appearing with me and talking to you and explaining what's going on in the community in health. Thank you all very much for joining us. We'll be back.